The nursing retention crisis. Understanding the nursing workforce trends. The nursing profession is currently facing a significant global shortage, with millions of positions unfilled. This shortage is compounded by an aging workforce and increasing retirement rates. As the demand for healthcare services rises, driven by a growing number of chronically ill patients and an aging population, the pressure on existing nurses intensifies. This leads to occupational stress, burnout, and dissatisfaction among staff. The shortage not only strains the workforce, but also jeopardizes patient safety and the quality of care, as there are not enough nurses to meet the demand. Retaining current nursing staff is crucial, as recruitment alone cannot fill the gap. Financial and operational impact of nurse turnover. Nurse turnover carries hefty financial consequences for healthcare organizations. The cost of replacing a bedside registered nurse can range from $45,100 to $67,500, with the average hospital losing approximately $4.8 million annually due to turnover. Each percentage increase in turnover can add an additional $262,500 to these costs. Beyond direct financial losses, turnover disrupts operations, affecting the quality of care and increasing patient mortality rates and medical errors. The continuity of care suffers, leading to patient dissatisfaction and potential revenue losses. High turnover also results in increased overtime and burnout among remaining staff, further straining resources and morale. Critical factors contributing to the nursing shortage. Several key factors contribute to the global nursing shortage. Demographic shifts, such as an aging population, increase the demand for healthcare services, while an aging workforce leads to higher retirement rates. The prevalence of chronic diseases further escalates the need for healthcare workers. The COVID-19 pandemic has intensified these challenges by increasing workloads and pressures on nurses, resulting in higher turnover rates. Additionally, the limited capacity of nursing education programs restricts the influx of new nurses into the field, creating a cyclical problem that affects patient care and safety. Looking ahead, the next lesson will explore the factors influencing nurses' intention to stay in their roles. It will delve into the relationship between job satisfaction and organizational commitment, as well as the impact of the work environment on nurse retention. Understanding these elements is essential for developing effective retention strategies and ensuring a stable nursing workforce. Key takeaway: the global nursing shortage, driven by an aging workforce and increased demand for healthcare, has significant financial and operational impacts on healthcare delivery. A hospital experiencing high nurse turnover incurs costs up to $67,500 per nurse replacement and faces increased patient mortality rates due to disrupted care. Has your organization been impacted by high nurse attrition? Actionable step. Healthcare administrators should focus on retention strategies throughout every aspect of the nurse-to-organization relationship to mitigate the financial and operational impacts of nurse turnover. How can you begin to think differently about nursing turnover in your organization, starting at the point of nurse recruitment and through the first 2 years? We'll cover more important insights in the next section.